Nurse Choma, founder of Choosing Nursing, and I'm here today. I'm going to be talking to you about infection control. We're going to go into some really good topics today, and really going to lay out some stuff, and then I may use my, I have some supplies today. Oh yeah, this one came apart, okay. But yeah, I have some supplies today too, so I may also go over this too as well. So stay tuned until the end if you want to watch that and everything. And then if you are a nursing graduate, good morning, and you're preparing for your exam, go to our website. We have a free NCLEX predictor test, and the purpose of it's like an NCLEX questions, and the purpose of the test is to tell you how ready you are to prepare for your exam, and if not, what you need to be aware of, what you need to study, that kind of stuff. So visit the website and go to freetest.choosingnursing.net, freetest.choosingnursing.net. If you need a month of RN NCLEX review, go to the website choosingnursing.net and go to where it says the Shop Now page. And I would recommend you can get the month subscription for the 3-day content review replay, which includes like a lot of content review on top of quizzes and then additional resources. So visit the website choosingnursing.net if that's what you need. All right, and it will definitely prepare you and help you. The 3-day content review is for RN, LPN test takers. All right, so anyways, and then also thank you so much. And then as well, on top of that, I also want to share with you too, for those of you that wanted to get our nursing mugs, we do have our nursing mugs here. It's called, pretty much what it says on it, it says, I didn't choose nursing, nursing chose me. I didn't choose, and I don't know if you can agree with that, but I know I personally can, that I didn't really choose this profession. It really just chose me, and it just kept on showing up. So if you want to get a mug, if you visit the website choosingnursing.net and go to the products page or the Shop Now page, scroll to the bottom. What we do for every person that buys one, we donate 10% of the sales towards either the Good Samaritan Foundation or the American Nurses Association. So we pick a charity that we donate to, and then also as well, this does ship to the Canada, UK, but I don't think it goes to Africa though. So I'm pretty sure those are the only countries. I'm going to share with you some important facts, and then we're going to talk about what are some things that we're doing about it, what you need to know. So I'm going to share with you a couple statistics first, okay? And these are kind of alarming, but they're real. So it says in pretty much in American hospitals alone, so in the United States, according to the CDC, which is known as the Centers of Disease Control, they estimate that hospital-acquired infection, so meaning that they got the infection while they were in the hospital. So hospital-acquired infections are estimated about 1.7 million infections per year. Can you believe that? That's a lot. 1.7 million infections per year from the hospital, and 99,000 of them cause deaths per year. That's a lot to me. 99,000 of them cause death. So about 2 million people per year in the hospital get an infection because of the hospital. And about 100,000 of those people actually die. Isn't that crazy? That's really alarming. So it tells us that what do we need to do, right? What do we need to be aware of in order to prevent this epidemic from happening and from affecting patients? And that's what this week is all about, is identifying patient safety awareness topics. And these are also topics that naturally relate to the NCLEX exam as well, because when it comes to the NCLEX, you do need to know nursing precautions. You do need to understand different types of things that influences the care of your patient, right? That's what a nurse does, and that's how a nurse thinks. So here's a couple of percentages I want to share with you as far as all of these infections. You got 32% are from UTI infections. All right, 32% are from UTI infections. And then let me ask you really quickly, what do you think is the source of the UTI infections while I'm going through all of them? Then you have 22%, which are surgical infections. So pretty much from the surgical site is 22% of those. Then you have 15% are pneumonia or lung infections. All right, pneumonia and lung infections. And then finally, then you have 14% that are bloodstream infections. All right, so 32% are from UTI infections in the hospital. Tell me what do you think is the source of that really quickly in the comments. 22% are from surgical site wounds. 15% are from pneumonia or lung infections. And then 14% are from bloodstream infections, right? Foley catheters are a huge source of infection that's contributing to UTI infections for patients in the hospital. All right, so as nurses, you need to be aware of what are the most common infections, all right? Because these are the type of infections. So the thing about the exam, for those taking your NCLEX exam, is that the test always focuses on what's predominantly occurring in the nursing field. Thank you for the hearts and the super hearts. All right, so you have to be aware of what's common in order to know what we would do and how we would respond, and etc. So I'm going to give you 1, 2, 3, 4, 5, 6. All right, there's 6 specific hospital infections. Somebody put this in the chat box for me. There's 6 specific common hospital infections. Number 1, all right, is a catheter-associated infection. All right, that's the first one. A catheter, oh, my thing is all the way over there. A catheter-associated infection. All right, so which is from the Foley catheter. That's the first one. And remember, all these ones, right, these are very important to take note of. All right, as far as nursing, this is why we have JCO that comes to the hospital. This is why we have core measures. This is why we, why the manager's so strict on us, right? Because it actually does matter, So, so you have catheter-associated infections. That's number 1. Number 2 is central line associated infections. Central line. All right, central line associated infections. All right, then you have the third one is surgical site infections. All right, surgical site infections. Number 4, all right, number 4 is hospital onset C. diff. Let me say it one more time. Number 1 is catheter. So from a catheter associated infection, that's number 1. It's not in the order of most predominant. It's just, I'm just listing them out just so you know. Number 2 is central line associated infections. Number 3 is surgical site infection. So meaning that they had surgery. And then after they came back from the surgery, we had to, like the wound got infected. Okay. And then number 4 is, it's just 5. I thought I put 6. Yeah, it's just 5. All right, so number 4 is hospital onset C. diff. Hospital onset or hospital acquired C. diff, right? So meaning that they got C. diff because of the hospital, all right? And then the last one, number 5, is sepsis. All right, is sepsis. So I'm going to talk to you about what are the symptoms, right? What are the signs and symptoms? And then what is the important nursing precautions for each of them, right? What are some of the important precautions? The first one, let's first talk about the catheter associated infections. And I'm going to focus specifically on Foley catheters. How soon should we discontinue Foley? So 1 to 2 days, 24 to 48 hours, we would want to discontinue the Foley. Normally, Foleys are only inserted because of the surgery. All right, so a lot of times the Foleys are inserted because of the surgery. Now, there's different scenarios though where we may put a Foley in, and that's because they're having bladder retention or urinary retention. Then that's different. But a lot of times, the reason why we put a Foley in initially is because they're going through surgery. And so once they get back from surgery, now they need to start walking, right? Peeing on their own, good morning, eating everything, and we need to take out that Foley as soon as possible. So one of the, I believe, is a core measure, and core measures are pretty much a list of standards that we have to comply with based on JCO, the Joint Commission Hospital Accreditation Association. So one of them is that you have to discontinue a Foley within 24 to 48 hours post-op. All right, and that's going to reduce the incidence of Foley catheter infections. Also as well, of course, putting in the Foley. Okay, so when we're putting in the Foley, so let me ask you a quick question. Of the three choices, who can put a Foley catheter in? RN, LPN, or CNA? What do you think it is? RN, LPN, or CNA? Of the three choices, who can put a Foley catheter in? All right, so let's say in the event that we're putting it in, we may be putting it in prior to when they come in, prior for the surgery, right before the surgery, or we're putting in, like I said, likely because the patient we're putting in likely because the patient has a bladder retention or urinary retention, anything of that nature. So here's the answer. All right, here's the answer. Both the RN and LPNs can put Foleys in. All right, so both RNs and LPNs can put Foleys in. So not just RN only. All right, so that is part of the LPN role as well. All right, so LPNs can put Foleys in too. Okay, and Foleys, LPNs, especially like in a nursing home, I mean, that's something that's very common, especially doing self-catheterizations, or not self-catheterization. Sometimes we do like a one-time catheterization. LPNs need to do that, right? Especially in that type of setting. And then also also as well with Foleys, I lost my train of thought. There was something else I wanted to mention about that. But it's both RN and LPNs, okay? It's both people. Now, here's the thing. When we put a Foley in, hey, good to see you, Crescentia. When we put a Foley in, what type of technique can we use? Is it sterile technique or aseptic technique, which is clean technique? Sterile technique or aseptic technique? All right, so remember, these are like the little different things that are nursing precautions that will help to alleviate and reduce infections and infection control in the hospital setting. All right, so sterile, okay? It should definitely be sterile. And you have to maintain sterile technique when we're putting in a Foley catheter, all right? Because otherwise, then there's going to be a risk of a huge risk of infection, right? So it's definitely sterile technique, okay? So those are the precautions when we have Foley catheter associated infections.